Next up, let's find out a little bit more about respiratory therapy. Even when minutes without oxygen can mean the difference between life and death, respiratory therapists jump in and help play a critical role in saving the lives of individuals daily. Let's look in University of Missouri Healthcare and find out about this fascinating, trending field.
Welcome to MU Healthcare, the region's only academic health system, with 7 hospitals and over 50 outpatient clinics. Here, over 6,000 dedicated healthcare professionals and more than 80 specialties work together to save and improve lives. Our teams are committed to providing patients with seamless care using the most advanced treatments and safest procedures. And among those professionals are respiratory therapists, also known as RTs, a crucial but sometimes unfamiliar role in the healthcare system.
When I started going to college, I had never even heard of the profession. I've never heard of a respiratory therapist. There's probably a lot of people that haven't even heard of us. But I was walking around the campus, saw this sign, and it simply said, respiratory therapy, life support profession.
A life support profession is a great way to describe it, since it's a respiratory therapist's job to treat conditions that affect the heart and lungs. That commonly includes illnesses like asthma, cystic fibrosis, and chronic obstructive pulmonary disease. But it also involves critical cases with life-saving care. So what does an RT do?
We can do anything from, simple respiratory treatments, nebulizer treatments, breathing exercises, trying to mobilize any secretions in the lungs so that people can breathe better, cough better, all the way up to managing a very sophisticated and complicated mechanical ventilator, which is somebody on life support, somebody with an endotracheal tube.
So Aaron, what are some tools RTs use on a daily basis that might help patients?
Great question. So I've got a couple things here. This is called a small volume nebulizer, or an SVN, and we use this to give breathing treatments to patients that have asthma or who may otherwise just be having a hard time breathing. This is what's called a BiPAP mask, and this helps to open up airway obstruction, so it goes on the patient's face. And we hook this up to a machine and apply positive pressure. And then another thing I brought here, this is called a laryngoscope. And this is what we use to intubate a patient, which means to put a breathing tube into their trachea to breathe for them. So this is called a mechanical ventilator. And this is one of the most important tools that we use in respiratory therapy. This is what we use to help people breathe when they're really sick or when they're unconscious. These ventilators have advanced so much in the last few years. It's like having a smartphone in your pocket.
RTs work closely in collaboration with doctors and nurses to provide seamless care. This role isn't always behind the scenes, though, as they often need to provide their professional opinions that bring important perspectives to patient care. So how exactly do RTs collaborate with other MU healthcare professionals?
RTs work with physicians and nurses side by side 24/7. For our examination, they're asking us for our opinion on how to coordinate patient treatments based off our assessment. RTs really take the lead when it comes to assessing respiratory conditions and recommending therapies based off what we see.
We work together with nurses, we work with physicians and collaborate on plans of care for better patient outcomes, and to try to get our people out of the hospital and back home to their families as fast as we can.
Doctors want their respiratory therapists to examine and make an assessment of the patient. Heart and lungs work together. Lungs, you think of respiratory therapy, but it also involves the heart. If there's a lot of fluid there, then I cannot get you to expand your lungs and breathe. So those two systems collaborate, which means we as professionals have to work together. Doctors might order something, but I might recommend a different therapy. They trust our judgment. You have to be ready to voice your opinion, make a suggestion, and back it up.
Being confident in a diagnosis can take years of training and experience, but it all starts with schooling and exams.
It's very similar to like a nursing program or radiology or other services, and usually a couple years of prerequisite college classes, and then the respiratory therapy programs themselves last about 2 years. As you go through that, then you have to take a board examination to receive your credential.
From leadership to working in a variety of clinical settings, there's many exciting opportunities and specialties in adult and child care.
There's so many areas to work in, and you can work in pediatrics in so many different areas too. The biggest difference in pediatrics versus like adults in the ICUs is more so that there's just a generalized difference of care and what they need. If they're in for a pretty severe issue, it's either some kind of accident or a respiratory issue.
There's a lot of different areas you can work in being a respiratory therapist. Of course, you're going to work with people, but you can work in clinic setups as far as for chronic diseases, as COPD, or something as working with cystic fibrosis patients. There's a lot of different avenues to go into.
We're just all over the place, from little NICU neonates all the way up to geriatrics and everything in between.
Everything in between also means from on the ground to up in the air.
We have the flight team, the ground team, the children's transport team, and so that's also kind of a specialty area where you need specialized training, but they get to travel either in an ambulance or even fly in a helicopter and go also with a flight nurse and physician or paramedic, and they go and take care of patients remotely.
A career as an RT can be rewarding in both the benefits and pay, as well as the overall experience.
I witnessed a remarkable turnaround in a kid that a lot of people didn't think was going to turn around, and I just saw the resilience of a person this big, and it was very special to be a part of.
I had a patient with a traumatic brain injury who had fallen down during a skateboarding accident. When he initially came into the ER, I intubated him as a respiratory therapist, and what that means is I placed a plastic breathing tube into his trachea to keep his airway open. We saw him off to the ICU and was able to watch his progress after that. We weren't sure if he was going to make it, but by the end of his journey in the hospital, he was better, and he was able to go home and be normal again.
Additional benefits are among some things to consider as an RT at MU Healthcare.
There's always a lot of job security for our profession because there's just a high demand for that.
I'd say some of the benefits of respiratory therapy working in the field would be flexibility of schedule, depending on where you work. If you work in a clinic, you could work 8 hours a day, 5 days a week. If you work in a hospital setting, most likely you'll work about 3 12s a week. And that can be beneficial to you, as you could potentially work 3 days in a row and then have 4 days off.
At MU Healthcare, I'm using the tuition assistance benefit to go back to school for my degree. You're able to go to school and they provide assistance for it, 75%, which is a huge deal. I think it's a great thing. It's one of the reasons why I came to work for MU Healthcare.
Choosing a career path can be difficult. Here's some advice MU Healthcare RTs have if you're considering this line of work.
My advice would be to come and see what it's like. We allow students to come and shadow and see what we do, talk to a respiratory therapist, and find out what their day is like, to find out if this is right for you.
And at the end of the day, RTs feel they've made a difference.
Our mission is to save and improve lives at MU Healthcare, and that's why most respiratory therapists get into this profession.
First job I ever had that I don't mind waking up and going to in the morning. I don't wake up and say, oh, I gotta go to work. I love my job. I love what I do. I'm dedicated to what I do. And that's, if you want to be a respiratory therapist, you gotta be dedicated.
Now joining us live is Nikki Carter, Director of Belonging and Community with MU Healthcare, and following her, Erin Shepard, Director of Respiratory Care, who you saw in the video. Nikki, welcome to Healthcare Career Day.
Hello everyone. I hope you enjoyed that short video of what your life can look like with us at MU Healthcare. My name is Nikki, and I'm the Director of Belonging and Community Impact at MU Healthcare. In my role, I get to encourage people to learn and be their best selves, because I know how important it is to be in an environment that is welcoming and makes me feel like I'm a part of the family. One of my passions is connecting people to their purpose, which is why I love getting to spend time with people like you who are looking to the future and exploring who you can be. I'm super proud of my fellow healthcare team members. Altogether, there are over 9,000 of us. We are a talented and diverse group with such a range of life experiences, skill sets, and talents that are all focused on saving and improving our patients' lives. I'm here with my good friend, Aaron, to talk about his personal healthcare journey and how we at MU Healthcare can be a great place to learn about yourself and learn about who you want to be professionally. Welcome, Aaron. Thank you for joining me today to share with our audience about the respiratory therapy profession. We saw you in the video, but can you tell us more about what attracted you to the RT profession and why you chose to pursue it?
Sure thing, Nikki. Something that was really important to me when deciding to become a respiratory therapist was knowing that I could have a job where I could make a difference in people's lives every day, every time I go to work. As I began researching respiratory therapy when I was a college student, I felt like it was a good fit for me. What I learned was that it's exciting. There's a team atmosphere involved. You can work in a lot of different areas of the hospital, the ICUs, the emergency room, and everywhere in between. Lots of options for growth, a strong job outlook, and strong job security. So those are all reasons why I chose to be a respiratory therapist at MU Healthcare.
What is required? Can you tell us a bit more, Aaron, about what is required to become a respiratory therapist?
So you need to go to college and get a degree, an associate's degree or a bachelor's degree. A bachelor's degree is typically preferred. The University of Missouri does have a respiratory therapy bachelor's program. It has one of the highest passing rates in the country. And then after you finish your schooling, you have to take a board exam. And it's a test to make sure that you know everything there is to be about becoming a respiratory therapist, and that you have the knowledge and skill necessary to go out and take care of patients.
So RT offers a wide path and many opportunities. As a new RT, where would I start?
So as a new RT, you can, there are two levels, a CRT or certified respiratory therapist, and RRT, which is a registered respiratory therapist. And a registered respiratory therapist will be in higher demand. The pay will be a little bit more. You'll take care of more complicated patients. Also, as you advance in your career, there's specialty areas such as sleep studies, pulmonary function testing, and respiratory therapy even now has a master's degree program. In fact, University of Missouri has one of the first ones in the country, and you could continue your education and get a master's in respiratory therapy and advance your career. The program here, the rate for job placement is 100%. So it's pretty great.
Very great. I'm sure many of our friends would love to know, Aaron, what does a typical day look like in the life of a respiratory therapist?
A typical day could be a day or a night. And so we cover the hospital 24 hours a day. So depending on whether you prefer to work a day shift or a night shift, and there are some advantages to one or the other, and some people prefer one over the other. But normally a 12-hour shift, and you would do that 3 times a week. So you have extra days off during the week. Here at MU Healthcare, we do have non-traditional shift options that we offer. So if staff are wanting to pick up even some 4-hour shifts or 8 hours, we allow them to do that when they're available. So you would start out your day having a team huddle. So you'd get together with all of the other respiratory therapy coworkers, and you would receive an assignment from a supervisor who would be there as a resource for you throughout the day. And then you would get a report from the off-going respiratory therapist. So whoever has been there taking care of patients the last 12 hours or so, they would tell you about everybody that you're taking care of and what you need to know. So you get a good handoff, and then you go out and you work independently, but then also as a team with physicians and nurses and all the other support services.
Nikki and Aaron, I think we got a lot of questions lined up in the queue for you. If you don't mind, we'd like to go to a live Q&A.
Wonderful.
Okay. If we have them, Carthage Technical Center has some Q&A they'd like to pose over to you. Carthage, are you on the line?
Hi, we'd like to know, how do you stay updated with the latest developments and advancements in respiratory therapy?
Great question.
Yeah, thank you. That is a great question. So, as a respiratory therapist, you're required to receive continuing education in order to keep your license and your credential. And so here at MU Healthcare, we are always offering educational opportunities. We're bringing in new technology and trialing it all of the time. So we're up to date and using the most state-of-the-art equipment. We send our staff to conferences here in Missouri and even around the country where they can go and learn about new technology and new techniques. And so it's just, it's a continual effort on the individual respiratory therapist to learn and to grow, because it is changing all the time.
Yeah, good question, Carthage. We got a couple other questions. Jefferson City High School Project Lead the Way biomedical science class asks, can you explain the use of the vest that was placed on a patient in the video?
Sure. So that vest, it inflates and it fits tightly around a patient, around their chest, and it vibrates rather quickly. And the purpose for that is for a patient, for example, that might have cystic fibrosis. They have a lot of really thick secretions in their lungs that get kind of stuck in there. And so the vest is trying to kind of shake them out, mobilize them would be the term we use, so that they can so that they can cough them out. And so that is something that we use for patients that have pulmonary secretions that are hard to mobilize and to remove.
Yeah, great. A follow-up question actually was posed that kind of aligns to this. Is Jason from Van Horn High School Project Lead the Way class asks, what is the most serious asthma case you've seen?
Oh, asthma is pretty common. We see a lot of really serious cases. I've seen people that have died due to having a very serious asthma event. But in some cases, the more serious ones, they may end up going on life support on a ventilator, as you saw in that video. But most of the time, they do just fine, and we take care of them and we get them through. And we have a lot of good medications and good techniques to treat people with asthma. And so the vast majority do just fine, but you do get some that are very serious and very severe.
Aaron, we got a couple quick questions. Mr. Jamieson's class asks, in your career, have you ever come across a patient with only one lung?
Yes, I have actually. And normally it's not very common, but I have seen that a time or two. And so you can remove a partial part of your lung or even almost a whole side, and you can survive without that. And there's a lot of modern technology and ways to do that. You can ventilate one lung at a time, distinct from the other. And so it's rare for me that I've seen it, but yep, it has happened.
And Aaron, I would imagine one of the other students asked, do you work with babies? I would imagine you work with anybody from infants all the way up to elderly.
Yep, absolutely. Yep, we work with this tiniest babies that are just so small they can fit almost in your palm of your hands, and all the way up, every age, all the way on up through life. And in fact, we have a transport team here specifically for babies in pediatrics, where they get to go and fly and pick them up and bring them back, or in an ambulance like you saw in that video. But yes, we definitely work with babies.
Excellent. Well, Aaron, I think we're out of time for questions. And Nikki, thank you so much. Thank you for joining us and zooming in live from MU Healthcare.